MPN heroes have made a real difference in the lives of people with myeloproliferative neoplasms, or MPNs. In their honor, Insight is committed to recognizing the individuals and organizations who contribute to the MPN community. Our goal is to help people with MPNs be heard so that more research, solutions, and treatment options will emerge. Learn more about the 2014 MPN Heroes at Insight Booth 2212.
Blood was pumping at the second annual 3K 5K Run Walk. Participants were up bright and early and ready to hit the streets of San Francisco, starting at the Embarcadero. Over 900 people registered to participate in the event to support the ASH Foundation, raising over $95,000. Janssen Oncology joggers topped the fundraising leaderboard and had the most participants, 98 joggers.
We as Janssen are really happy to support this in order to support research and development in the field of hematology. So we're really a big group here of more than 100 colleagues from Janssen coming from all over the world, from Europe, from Asia Pacific, from the States of course. And it was a really nice race, and now we're happy to go back to the conference.
Congratulations to the top finishers. I'm Rachel Kopchak for ASH News TV. The ASH Practice Partnership Lunch is the place for practice-based hematologists to network and elevate practice-related issues within the society. The session focused on the challenges associated with mergers between traditional community-based private practices and larger healthcare systems. These changes bring a new set of challenges to practice-based hematologists in any stage of the process, from hematologists who are considering a merger to those who are already participating in a new system.
Whatever strategy you choose, you have to understand that everyone's being measured, it's all public, it's going to affect payment, and scoring roll is going to matter.
Speakers addressed issues that hematologists will face at any stage of the transition, including overall recommendations for practices on the verge of a merger, economic impact and reimbursement, changes in leadership and practice models, and bundling of treatments for better outcomes on quality of care.
Ms. Gosfield, an attorney specializing in this area, pointed out many of the challenges facing physicians who are contemplating having their practices acquired by hospitals or other healthcare systems, and what their alternatives are to protect their interests and their patients during this time of change. Dr. Pecora provided an example of how a large group of practicing hematologists were able to band together in the state of New Jersey to form a single group that could deal effectively with insurers and find a way to provide the type of data regarding quality of care that insurers are increasingly demanding.
The drug approval process in Europe and North America, as you know, is quite different. That's why the joint EHA ASH Symposium focused on new drug development for orphan diseases as well as molecular subsets for heterogeneous diseases. This is the 8th year for the joint session, which focuses on issues the two societies have identified as important to hematologists around the world. This year's topic addressed both the industry and regulatory sides of the approval process for drugs, as well as levels of clinical evidence required for approval.
The fact that we are joint in these efforts to get these topics discussed openly comes because we get together and we find they're important. And I hope that people come because if we're joined, then they think maybe it's important.
ASH is also recognizing the members who have contributed so much to the society over the years with awards for mentoring, outstanding service, public service, and the prestigious Wallace H. Coulter Award. This year, the Society's highest honor went to Dr. Kanti Rai, saluting his 50-year career combining landmark clinical leukemia research with a commitment to education.
I am not a single individual. I represent a large, complex combination of people and institutions that have made me what I am, and my gratitude to all those supporters. Thank you.
From new strategies targeting anemia to new therapies for treating leukemia patients, it's all happening here at the annual meeting.
There were two early phase studies looking at treatment for beta thalassemia and for myelodysplastic syndrome, which looked at raising the hemoglobin with these two therapies, which are similar but yet work slightly differently. And both were very, very promising.
So we saw 6 different clinical study results, some of which are combining existing therapies, already approved therapies in new ways, using them in new ways, but most of which were either new therapies or adding a new therapy to existing chemotherapy. So really a broad spectrum. Some of the studies were acute lymphoblastic leukemia, several were for acute myeloid leukemia, and together I think what these really show is that, you know, there's still a lot of patients with acute leukemias for which current therapies fail, and we need to move the bar forward, and we're trying to do that collectively as a leukemia community.
The last trial was really a fascinating one. It was a first-in-human clinical trial of a new agent that targets factor 11 in preventing thrombosis. The investigators did a randomized study in patients with total knee replacement surgery, comparing 2 doses of this antisense to factor 11 with low molecular weight heparin as enoxaparin, 40 milligrams daily for elective knee replacement surgery, and found that this agent, when it administered in the higher of the 2 doses that were studied, was extremely effective in reducing thrombosis risk. These were asymptomatic, primarily asymptomatic venogram detected thrombosis 8 to 10 days after surgery. And really interestingly, there was not an increased risk of bleeding with this new agent.
An exciting look into the future of thrombosis treatment will be the session Comeback Kid, the Contact Pathway, and Factor 11. Dr. Nigel Key will chair the session, which will focus on biochemical and mouse model data, supporting the case for therapeutic targeting of factors 11 and 12.
It sounds a little bit rarefied, but actually the emphasis here is on the identification of potential new targets for anticoagulants, and more importantly, we've seen a huge flux of new products in anticoagulants in the last few years, but we're still looking for that holy grail, which is the anticoagulant that prevents blood clots but doesn't cause bleeding. So there's a lot of interest in the contact pathway that's just beginning to emerge into the clinical arena now.
Dr. Key's session and more will be available in full on ASH On Demand, a multimedia platform that offers convenient, on-demand access to a wide variety of educational materials. Visit ashondemand.org to find out more.